Hello and welcome to the office-based dental anesthesia practice webinar. And we are so happy to have you as participants in learning about providing anesthesia in a dental office. I'm Kathy Harrison. I'm from the state of Virginia, and I am just delighted to be the moderator tonight. I do want to explain that the objective tonight is, obviously you can see on your screen, is to describe CRNA office-based dental anesthesia practice, including the business considerations, state licensure, permit requirements and compliance, monitoring and equipment requirements, clinical considerations and anesthesia techniques, reimbursement arrangements, which is very important, barriers to practice, and available AANA resources, which there are a tremendous amount. Again, I'm Kathy Harrison, and we have tonight Ali, Jason, and Stephen, who I would like for each one of you, starting with Ali, to introduce yourself and tell us a little bit about where you are and about your practice.
Sure. Hi, everyone. My name's Ali Bagai. I'm here in Arizona. I'm a partner with Arizona Anesthesia Solutions. Our group covers a broad range of anesthesia and, from dental offices to hospitals. I'm one of the directors of the dental part of our practice. I also serve on the Arizona Dental Board on their anesthesia and sedation committee, and do lots of dental anesthesia myself.
Well, thank you, Ali. How about you, Jason?
Hi, my name is Jason Jarrett. I practice in Louisiana, and I wear a lot of different hats, but I'm the owner of Dental Anesthesia Services, and I have a great team of CRNAs that work with me, but we cover 61 dentists and plastic surgeons and provide office-based anesthesia in those areas. I'm also on staff at Ochsner LSU Health, which is our large tertiary care academic trauma center facility in Louisiana. I'm the clinical coordinator, and I have, for CRNA education, I have 28 little ducklings right now, little CRNA students under my tutelage that we're trying to mold. And another hat I wear is I'm one of the medical command for a large metropolitan fire department, which I bring that up because when we go into dental anesthesia, I'll be able to explain how some of that relates to being independent and being autonomous in those dental anesthesia offices has really coexisted with that. So I'm excited about the webinar tonight and look forward to giving some additional information on office-based anesthesia.
Great. And Stephen.
Yeah, hey guys, Steve Smith here from Atlanta, Georgia area. And I co-own a 100% office-based CRNA practice here in the greater Atlanta area. We have just over 25 practices that include everything from orthopedic to vascular, GYN, infertility, and a lot of dental, probably about 15 plus dental practices. Not as many as 61, Jason, but I'm happy with it. Yeah, primarily periodontists, a few oral surgeons, and a few general surgeons. And we'll get into this later in the discussion, but here in Georgia, they are required to have a dental permit for us to be able to practice with them in the office. And we'll get in more details in that later. But I'm proud to be part of this tonight, proud to be part of the AANA dental anesthesia panel. And one other plug, we're also proud to have the Emory students at our orthopedic rural practice, and that's been a lot of fun this last couple of years.
Well, thank you, all of you, for being here this evening. And just a little bit about me. I've practiced in anesthesia care team settings, and then 21 years ago, I decided I needed to do a little something different. So that's when I began my own business in providing anesthesia for plastic surgeons and dentists in the Richmond area in Virginia. And I love it. I think that the group here can provide some really in-depth information in how to set up your practice and how to provide the best care for dental patients in your communities. So let's get started. There obviously are quite a few variations, as Stephen alluded to, as far as regulations for the state. So if you'd like, Stephen, why don't you go ahead and start with what is happening in Georgia?
Okay, yeah. Well, we practice under a couple of different acts here in Georgia. The Nurse Practice Act, where we are under the direction and responsibility of an MD or DO. So that's a bit restrictive, but we are able to practice with general dentists, periodontists, and oral surgeons if they're permitted. That supersedes the Nurse Practice Act. So that's why I'm able to practice. But with that, if I was able to go in and practice without the dentist having their permits, I'd probably have 50 more dental practices. So it is a restriction, and I just want you to be aware of that. If I could give one important point is, if you're thinking about doing something like this, the very first thing you need to do is look into the legal aspect of what CRNAs can do and not do with general dentists, periodontists, and oral surgeons.
What about you, Jason?
Yeah, that's a very, very important point Stephen just brought up, because we're very fortunate in the state of Louisiana that our dentists do not have to have those permits. So we can go into any office and provide those services. The only permits that are required are an office permit, which is a permitting process that says that the office is a safe environment to undergo those type of IV sedations. They look for things like, do they have backup electrical supply? Is the room large enough to accommodate a resuscitation team? Things of that nature. The only thing that is required in the state of Louisiana is that the dentist, if a person is above the age of 13, a dentist has to have ACLS. If they're below the age of 13, the dentist that you're doing the work with has to have PALS. This was a measure put in place about 3 to 4 years ago. It was an attempt by the oral surgeons to kind of restrict the access to those offices, because some dentists would say, well, I'm not going to get the ACLS, so I'm not going to continue doing IV sedations. But it's not as restrictive as a state like Georgia or Texas. So we're very fortunate in our state that we have overcome those barriers.
Allie, what's it like in Arizona?
Like Stephen said, we've got permits, special permits. There's definitely some trade restriction that exists. Dentist anesthesiologists are able to obtain a permit and go office to office, where both CRNAs and physician anesthesiologists are actually on equal footing in dentist offices here. So we're working pretty hard this next legislative session to change that.
Well, just a little bit about Virginia. We do work on, we are board under the boards of joint boards of medicine and nursing for our nurse practitioner. We are considered nurse practitioners. We are licensed as nurse practitioners. However, we can, through our regulations, we can work with dentists, physicians, DOs, and podiatrists, which is kind of interesting. We can be supervised by them. And then, of course, we work under our regulations, and also we go to the Board of Dentistry to find out what their regulations are. And the dentists that I work with do have to have a permit in order to provide supervision, loosely said, to nurse anesthetists. And I found that it works very well as a team effort for the dentist to do the dentistry, the assistants to provide the assistance, and for nurse anesthetists to do the anesthesia or the sedation. I worked with the Board of Dentistry for about a year doing inspections for offices that did have permits. So I'm very aware of what the regulations in the state of Virginia are requiring for emergency care and that kind of thing in the offices. We did have a big win, however, on the 4th of December when the Board of Dentistry met, and they had some question about one of the regulations that said that dentists who do not have a sedation permit can work with other dentists who are trained in sedation and anesthesiologists. Well, for many years, we worked with the Board of Dentistry trying to help them to understand that we're as well trained as an anesthesiologist. So on the 4th of December, the Board of Dentistry decided that it was okay for dentists who do not have sedation permits to work with other dentists who have been trained anesthesiologists and CRNAs in the state of Virginia, which is a huge win for us. Better yet, it's a huge win for patients in Virginia who had limited access to care because of their fears, and the dentist did not have the ability to provide sedation. So we're pretty excited about that here in Virginia. That's just one
Absolutely.
little thing that we've been able to accomplish just in the past year. So, well, moving along, now that we've gotten all the regulations out of the way, what would you say, let's start with you, Jason. What would you say if, you know, how would you develop a relationship with the dentist? How would you get involved in providing the dentistry in their office, their sedation?
Yeah, that's a great question. You know, it can be really encumbering and overwhelming to decide to get into doing dental anesthesia. What I encourage people to do most is talk to your personal dentist and see who are. I call them mega practices, but the mega practice that I have has over 27 dentists. So determine where the volume's going to be and where those large practices may lie. Also, dentists who typically do a large amount of extractions, or certainly dentists that use anesthesia services to do these extractions. So rely on your personal dentist maybe to form those connections and put you in touch with those type of people. And that may go a long way with getting you access to those dentist offices. Another avenue that you may use is every state has a state dental association. Well, within those state dental associations, each region typically has a regional dental association. So seek out that the president or some of the officers for that regional dental association and ask to give a lecture at one of their quarterly meetings on office-based anesthesia, and you'll be surprised about who will come up to you after that meeting or get in touch with you to inquire more information, and that may get you into the door to these offices.
What about the other two panelists? Do you have any other suggestions?
You know, I would just add that business is about relationships.
Exactly.
Developing those relationships, you got to get out there, you got to do all the marketing things that Jason mentioned. You got to become an expert, right? So know all those regulations for your state that we all mentioned to our individual states. You want to be able to go into a dental office and be able to talk to that dentist with, you know, complete confidence and expertise about what the rules are, what needs to be done, how you can get in there and provide services. And that's it. Once you get into one office and you start doing it, he talks to his buddy, then you're in another one. The dental office is a really small community. So if you're doing a good job, word's going to spread and your phone will be ringing.
Stephen, do you have any other comments?
Maybe a couple of things. And this applies to advertising yourself anesthesia wise. One thing that has really helped us over the last 10 years or so is we have an account with Google, and we have Google AdWords, and they let you have up to 20 to 30. And we pay about $300 to $400 a month. And there's certain words on there: office-based anesthesia, nurse anesthetist, dental, stuff like that. Mm-hmm. And they're key words. And when someone's looking for a practice and those words come up, our ad comes pretty much to the top in the first 2 or 3. So that's just one way to tackle it.
Great information, because there are so many ways that you can get involved, and I think that a lot of times we're limited by thinking that we're in an operating room and there's no way to get out there and meet people, but there really are. Okay, so once you've established that contract, what do you do? I mean, do you have a written contract with each practice that you're with? Do you have a handshake? Do you have, you know, what do you do? How do you proceed once you've gotten in your foot in the door? Anyone want to just start with this one?
No, I'll tell you my experience, and maybe it's regional to here in Arizona. Dentists are handshake deals kind of guys.
Absolutely.
Anytime that we've ever sent something as simple as a letter of intent to a dentist, they stop calling. They're like so scared of contracts. Nonetheless, you want to get something in writing, right? So if you can send an email, these are our rates, this is what service we're going to provide in an email, and they email back. Now at least you've got a paper trail, you've got something documented, so that if the time comes, you send them a bill and they're like, hey, this isn't what I agreed to. Well, that email that you replied to, yeah, it's there, even though they're contract averse. Now, if you can get a contract in place, great, but that's going to be more likely with like the corporate dental offices and those sorts of places. The general practitioner with his 1 or 2 offices, you're going to have a tough time getting them to sign a contract.
And I echo that, and I agree 100%. It's about relationships, as Ali said earlier, and forming those relationships and those bonds. It speaks volumes. And so I do the exact same thing. I lay out all the charges and specifics, cancellation fees, the whole 9 yards, and we provide the same exact fee schedule to every single dentist that we cover. There's no difference in charges. And so, but you start discussing contracts, and in Louisiana, we call it crawfishing. They'll crawfish right out of there.
Yeah, the only thing I have to add to that is, and I'm a little embarrassed to say, but I felt better after Ali made his comment. We're real sticklers about contracts in the bulk of our big practices, except for dental. Like I said, we have 15 practices, and not one of them do we have a contract. With that, we haven't lost one contract since we've started going there. Do a good job. They love us. There's no way they're going to not use us. So if you can get a contract, go for it. But if not, don't worry about it too much.
And the reality is any contract can be broken. We're like you, Stephen. Our hospitals are all contracts. Our ASCs are all contracts. Our dental offices are not contracts.
Yeah.
But a contract's just a piece of paper. If you're not providing a great service, you're gone.
There's a 30-day out, so you're gone in 30 days, basically.
That's it.
Yep.
Well, speaking of that, what about equipment? Do you supply your own equipment, or do you have the offices supply the equipment, the medications, et cetera? How does that work for your practices?
For us, it varies. Or go ahead, Jason.
No, again, you and I must have the same practice. Ours varies as well. Now, we have some dental offices some of our pediatric offices that we're doing 20 cases a weekend. And so those offices, we maintain equipment there. But some of our other offices, we may do 1 case a month, and it's not financially feasible to leave thousands of dollars worth of equipment in an office that's going to be utilized once a month. And so those offices, we have portable equipment that we transport from office to office. As far as drugs, we provide all the resuscitation drugs, and we keep those with us. But the DEA does not really like you transporting scheduled drugs around town. And so every office that we cover has a safe, and when you order drugs, those drugs are stay at that facility in the safe with a drug log that if the DEA or the dental board decides that they want to come over, they can do a chart audit and be able to track where those drugs were purchased, when they were received, and the accountability for those drugs.
Right. Well, that's one thing I did notice a lot when I was doing the inspections, was we were very much attuned to keeping up with the medications and the log and making sure that everything was done appropriately. What about you,
I would like to speak to this, if I could, Kathy, just for a minute. Here in Georgia, it is an absolute no-no to supply any drugs, equipment, or supplies to an office, particularly dental. They have it written in the dental code that you cannot transport equipment or drugs from one office to the other. And be careful about supplying this stuff, guys. There's AKS rules out there, anti-kickback statutes. If they're billing Medicaid and they're on any federal program and you're supplying equipment, you're at risk, bottom line. And the other thing here in Georgia that we have is we actually have a state law, it's in the code, that you cannot provide remuneration for referrals. So just be careful out there what you're doing. Know the laws. Try to get with a mentor in your state who's doing this already and knows the rules, so that you don't do something ignorant that you just don't know about. So be aware of that.
Yeah, that's a good point Stephen brings up. Most of, at least in our practice, because especially here in Arizona, CRNAs cannot get reimbursed from government payers in an office, in a dental office. So all of our dental work is cash. So what we actually do, we're similar to Jason. Some places have the equipment, some don't. But for us, the offices that have the equipment, they buy that equipment. And so we actually have two different rates. So we have a rate for when we bring in all the equipment and supplies except for the controlled substances, and then we have a different rate if they have everything. Like we work with some oral surgeons. A lot of oral surgeons will provide their own sedation when we're not there, and so they have everything there. So we just provide personnel. But other offices where we're bringing everything in. But it is all, the anti-kickback statute stuff is definitely something to be leery of, especially if you're going into a facility that's charging a facility fee.
Exactly. And we actually have it in our Dental Practice Act in the state of Louisiana, the portability of equipment, and so does in, I believe, Texas as well. And so we're fee for service only anyway. We do no insurance or billing, and we can accept it as well. So very, very valid point, Stephen.
Yeah, and that's what I do here in Virginia. It's a fee for service. I bill directly to the patient and they pay me directly. And if they want to try to get insurance to, help them out, then that's fine. But we found that most of the procedures that I do are not covered under insurance, dental insurance. So
one other quick point I'd like to make on cash reimbursements, because we all got together months ago and everyone agreed that cash was the way to go. That's the most popular. What I do when I go in, I have my set fee, and either the practice can pay me or the patient can pay me. What I recommend to them is they know my fee, so I like to get reimbursed from the practice. That way they can do an upcharge or whatever they want to do to cover their supplies, equipment, and drugs. And they're very happy with that. It works out good for everyone, and the patients go for it and everyone's happy. So that's just, it works for me.
And that's our model is that we accept no cash payment from patients. We strictly bill the dentists themselves. That allows the patient to pay one single charge. And once their treatment plan is given to them by the dental office, it's a one solid charge. They're able to use things like care credit, put them on a MasterCard or Visa, or even structure a payment plan with the dentist. It also keeps us from having non-sufficient checks and having to worry about that end. So we bill the dentist, we invoice them, and then require them to pay us, and it's served us well over the 13 years.
I wonder if there's anything different between our practices, Jason, because we do the same thing.
We're brothers from a different part of the country here.
Well, we've talked a little bit about emergency equipment and making sure that we have everything that we need. I think that all of us and the majority of our peers would attest to the fact that we are very conscious about patient safety. So what are the basics that you would suggest that if someone came to you and said, hey, look, I'm thinking about doing this. I'm a little concerned because I'm going to be the sole provider in a dental office of all places. What would you suggest as far as just the basics for getting someone up to speed, and then also, talking about what to look out for as far as sharing the airway and that kind of thing? Who wants to take that one? Stephen, you're looking like you think it.
I'll be happy to.
I can take it.
Yeah, go ahead, Jason. I'll follow up. Or Allie, I'm sorry.
I'll be honest. I tell our dentists, and we provide everything. Like I said, I work at a very large trauma center. We provide everything that we have in that operating room at Oshner LSU Health except an anesthesia machine. The worst thing in the world, as most CRNAs know, is being in a bad situation without your tools. Right. And without the things that you need to resuscitate someone. So we have bougies and LMAs and everything else that we would ever need to be able to resuscitate within that office. And so that's just our method of doing things. It goes back to my pre-hospital days of being a nurse on a helicopter for 10 years and a paramedic. I always want my resuscitation tools available. So if anyone's going into these offices, remember you are solo. And one thing that really struck me when I first started doing this, that remember, dental people are not medical people. They're not nurses. They don't have very much medical knowledge. They have a lot of dental knowledge, but they have very little medical knowledge except for basic life support, CPR. And so you may be in a situation where you have little to no help, and you're not only treating the patient, but you're treating the staff also to calm them down in an emergency situation. So those are the things that I like. I need to have to make myself comfortable within that dentist office. So I'll let someone else speak to that. And there are some other tools that I'll go over, and the other guys can go over in just a minute about that are different with a shared airway.
Yeah, I would just say the standard of anesthesia care doesn't change whether you're in a hospital or a surgery center or an office. All the same monitors, all the same preoperative evaluation, everything that you would do in a hospital-based setting, you should be doing in a dental office and have the same equipment available.
Yeah, one other quick note is follow those AANA standard of care for office-based practices. Those, you know, you gotta, if anything happens, the attorneys are gonna look at the standard of care. So go by the AANA standards of care. And also anyone who's interested, get on the AANA, or actually the CRNA dental Facebook site, and private message me. I have a phenomenal list of all the supplies, equipment needed for office-based general anesthesia and office-based IV sedation. I'll be more than happy to share that with you. It'll be a good starting for you.
Well, and also a plug for our dental anesthesia or dental advisory panel members who have worked tirelessly to provide information that you can find on the AANA website under practice concerning the business of dental anesthesia, how to set up an office, the office-based practice regulations, and just a plethora of information. So I've got to put in a plug because I know we've all been working very hard on all of those documents to get them into the AANA resources for us. And also I want to go back to just one other thing. You know, the state government affairs for the AANA can provide all kinds of information if you're interested in finding about regulations about dental practice and office-based practice in your dental offices in your state. So you've got to always remember that the AANA has a wonderful resource for us to help provide safe anesthesia practice. All right, well, we're getting a little close, but I did want to have another question. And here we have all kinds of information that has come up on our site as far as, you know, providing that information. And thank you so much for getting that up there because, again, like I said, we have worked tirelessly to get this information together and make sure that it's very user-friendly.
Well, I'm gonna give just a couple little tidbits of advice for people who are doing dental anesthesia. One thing to remember is that you're not only responsible for that patient within that time frame that you have them in that dental office, but when they leave that office.
That's
Unlike
correct.
working in a hospital or ambulatory care center where you can turn over your care to a recovery room where an anesthesiologist or another fellow CRNA may be in charge of managing that care, you're releasing these people from an office. And if those people have to call an ambulance or, God forbid, have some adverse event where death occurs, it may not only make local news, but national news. And so I structure my anesthesia to make sure that those people are able to be cared for in a manner that when they leave that office, they're back to baseline. And so that's an important point to remember. And also remember, I tell my CRNA students, the goal of that type of anesthesia is amnesia and cooperation, sometimes not lack of movement. And so you have to remember that your end result of that anesthesia in the operating room a lot of times can be intubation. But in an office-based setting, sometimes you have to back out of the anesthesia and not go forward into it because your end result can't be intubation. And so just a little bit of a tidbits for office-based anesthesia, especially the part of making sure that those patients, when they leave that office, are meeting discharge criteria as if they were being discharged from a day surgery area, not for going into a PACU.
Absolutely.
Exactly.
Yeah, a tidbit that I'd kind of like to leave too is, knowing that in a dental office, you're working with a dentist who's not an MD or DO, and you're working with dental assistants who are not nurses. So you got to be very aware that you need to educate them on what's happening and what's going on. You need to be very aware that when things get bad, if there's a difficult situation, that they're going to turn to you to lead what's happening, that you're going to be the one who's going to have to direct them, because they, granted, there's offices that you go into a lot and they become very comfortable and knowledgeable, but some of these offices, they're just not used to having sedated patients, and they're going to turn to you for guidance.
Very good point. What about you, Stephen? Do you have a pearl to leave with everyone?
Well, they pretty much touched it on the clinical things. I would like to sum it up by there in front of you, the aana.com/dental. Every stinking resource you would ever want and more is on there. If you're thinking about doing dentistry, you can spend a whole day on there. They've covered it all, and we've worked with them. I commend the AANA staff, and particularly Eva, for doing all this. It's phenomenal. And the other thing, if you're thinking about doing dental, find a mentor. Someone like me, I love helping people around the country, particularly here in Georgia. I'll be more than happy to pass my wisdom on to you at any time. So that's it.
Well, I think that all of us would be more than happy to help anyone who is interested in providing anesthesia in a dental office. Like I said, I've been doing this for 21 years, so I have a little bit of experience, just a touch. But I'm always happy because, bottom line, we're all about safety, and we want to provide the best care that we possibly can. And I really thank all of you for being a part of this webinar tonight. Appreciate all the help from AANA, and I hope that everyone has a great year in 2021. Thank you.
Thank you all.
Thanks.
Have a great one.
We've all been there, in the dentist chair for a procedure to fix a cavity, crown, extract a tooth, or for dentures. Your concern? Being comfortable and pain-free. And that's why it's important a certified registered nurse anesthetist, or CRNA, is on your dental team. CRNAs are highly educated and trained anesthesia experts. There's nearly 54,000 in the United States today. They provide more than 49 million safe and cost-effective anesthetics each year. With an aging U.S. population, the need for CRNAs is growing. CRNAs partner with your dentist to determine the best care and ensure your safety and comfort. Depending on the procedure needed, the CRNA has 3 types of anesthesia to choose from: local, sedation, or general. They can be combined with other medications. Ultimately, your plan will be specific to your needs, length of treatment, and procedure being performed. Local anesthesia is commonly used for simple procedures, like a cavity filling. The next anesthesia option is sedation. Typically, a CRNA would use this for patients with anxiety, children who struggle to sit still, or special needs patients. Dosage levels can be mild, moderate, or deep. Lower dosages allow the patient to remain conscious and communicative. Higher dosages keep the patient in a barely conscious state. Third is general anesthesia. This is typically used for longer procedures, where it's best for the patient to be unconscious. Safe dental anesthesia outcomes are best achieved when administered by a CRNA whose only responsibility is the sedation, monitoring, comfort, and safety of the patient. This allows the dentist and other team members to focus on the procedure itself. The next time you talk with your dentist, make sure they have a CRNA available on staff for all procedures. To learn more about anesthesia dental care and CRNAs, visit our website, crnasafe.com.